Good evening. My name is Asani Ritchie, EMT assigned to the Negril Fire Station in the Jamaica Fire Brigade. Today I'm going to do a brief presentation on 5 of the medication that as EMTs we are allowed to administer. Some of them we have to get approval from medical control. Now, first of all, before we can administer any medication, we have to make sure that the medication is for that particular person. It is the right medication. We are administering it in the right route. It is the right time to administer that medication, and it is the right medication. We also need to check the expiration date because we have to make sure that the medication is not expired. Right. First of all, we're going to discuss nitroglycerin. Now, nitroglycerin is a vasodilatory drug used primarily to provide relief of pain, mainly chest pain, or discomfort like angina, which is usually caused by insufficient blood flow to the heart muscle. Right? Indication for nitroglycerin is chest pain, mainly cardiac origin. Right? The contraindication is hypotension. Now, if you are administering nitroglycerin, you have to make sure that the systolic blood pressure is not below 100, right? Because if it's below 100, then nitroglycerin cannot be administered because it will lower the blood pressure, right? The dose for nitroglycerin, you give it orally, mainly sublingual, which is underneath the tongue. It comes in a tablet form. Sometimes it's a spray. You spray it underneath the tongue. Side effects may include headache, dizziness, weakness, or pain to the site of application of the medication. Right? Now we are going to discuss aspirin. Aspirin is another medication that we are allowed to administer. It is an anti-inflammatory drug used to treat mild or moderate pain. It helps to prevent blood clots, right, due to its blood thinning capabilities. So, an indication for this is you get pain such as chest pain or headache. Now, the contraindication, you can have increased bleeding because of the thinning capabilities of the aspirin. If you get a cut, it might bleed a lot, right? Now, the route to give aspirin is orally. It comes in a tablet form, mainly 300 milligrams, right? The side effects might include abdominal pain or vomiting. Now we're going to go to oxygen. Now oxygen, this is the main medication that an EMT is allowed to give in an ambulance, and it is a necessary medication inside the ambulance. Now oxygen in a nutshell is a colorless, odorless, tasteless gas. Under normal conditions, it makes up, say, 21% of the air that we breathe in the atmosphere, right? Indications for this is respiratory distress, hypoxia, shock, trauma, carbon monoxide poisoning. Yes. Contraindication would be COPD, which is chronic obstructive pulmonary disease. Right? If you give high flow oxygen to a COPD patient, it can be detrimental to them. Right? Now, route for oxygen, you give it orally or through the nostril, or both at the same time. Yes? So we normally use a device to administer oxygen. We normally use a non-rebreather mask, or we might use a nasal cannula. Nasal cannula is used to give a lesser flow of oxygen. Right? Now the side effects, you can have dryness if you don't have a humidifier attached to the oxygen. Mucous membrane of the nose and throat might dry out. You might, patient might cough. For a prolonged period of time, if you give oxygen, you might have oxygen toxicity. Right? Now we're going to move on to glucose. Now glucose is mainly used to increase the blood sugar level when it is low, which is hypoglycemia. It is low blood sugar. Indication is given to patient with low blood sugar. Yes, in a nutshell. Contraindication, unconscious. You don't want to give glucose to somebody that's unconscious or unable to swallow, because they can choke and vomit and maybe have a gag reflex. Right? Now the route for this is orally. It can be a paste or gel. Side effects, nausea or vomiting can occur while administering glucose. Right, so we're going to move on to the EpiPen. Now the EpiPen is used in a situation where a patient is having an allergic reaction, which is called anaphylaxis. Now the indication for this is, as the name suggests, it's an allergy. Right? You might see hives or urticaria on the person's skin. Right? Contraindication for this is hypersensitivity. Right? Route for this include intramuscular, which is mainly in the thigh muscle. Yes. Normally give 0.5 milligrams for adults. For children, 0.15 milligram. Right. Side effects for this is hypertension and tachycardia. You might have anxiety or a little bit of restlessness. Now this is the end of my presentation. Thank you.